taking the wrong magnesium? Full guide to deficiency, foods and types. Are you constantly tired, getting random muscle cramps, or struggling to fall asleep at night? You might be missing one crucial mineral that powers over 300 biochemical reactions in your body. In this video, I'm breaking down everything you need to know about magnesium, the hidden signs of deficiency, the top everyday foods to fix it, and the exact types of magnesium supplements you should take. Stick around until the end. Magnesium is an essential macromineral. It's the fourth most abundant mineral in your body and acts as a cofactor in more than 300 enzyme systems. Here's what it does. Regulates muscle and nerve function. Keeps your heartbeat steady and blood pressure in check. Controls blood sugar levels and aids in protein synthesis. Builds and maintains strong bone health. How much do you need? The recommended daily allowance is about 400 to 420 milligrams per day for adult men, and 310 to 320 milligrams per day for adult women. Part 1. Magnesium deficiency. Hypomagnesemia. Hypomagnesemia is defined as a serum magnesium level below 1.46 milligrams per deciliter. It is relatively common, especially in hospitalized patients, but symptoms often do not appear until levels drop significantly, below 1.2 milligrams per deciliter. Early symptoms occur with mild to moderate deficiency. Early signs are often nonspecific and can be easily mistaken for stress, fatigue, or other common issues. Fatigue and generalized weakness, a persistent feeling of low energy. Gastrointestinal issues, loss of appetite, nausea, and vomiting. Neuromuscular irritability, mild muscle twitches, cramps, or spasms, especially nighttime leg cramps or eyelid twitching. Mood and cognitive changes, mild anxiety, irritability, or apathy. Late symptoms in severe deficiency. If left untreated, severe hypomagnesemia can lead to dangerous complications. These are often exacerbated by concurrent low calcium hypocalcemia or low potassium hypokalemia, which magnesium deficiency triggers. Severe neuromuscular symptoms, tetany, severe, painful muscle spasms or carpopedal spasms. Positive Chvostek sign, facial muscle twitching when the facial nerve is tapped, and Trousseau sign, hand spasm induced by a blood pressure cuff, Q. Vertical nystagmus, involuntary, rhythmic eye movements. Seizures or convulsions. Cardiovascular complications, abnormal heart rhythms, arrhythmias, including atrial fibrillation or life-threatening ventricular arrhythmias like torsades de pointes. Electrocardiogram, ECG, changes, such as widened QRS complexes or prolonged PR intervals. Increased risk of cardiac ischemia or digoxin toxicity. Neuropsychiatric disturbances, delirium, agitation, psychosis, or even coma in extreme cases. What causes it? Common causes and risk factors. Factors that deplete magnesium. Even if you eat magnesium-rich foods, certain lifestyle and dietary factors can reduce your body's magnesium levels. Processed foods, refining or processing grains can deplete their magnesium content by nearly 85%. Alcohol consumption. Alcohol reduces magnesium absorption in the gut and increases its excretion through urine. Chronic stress. High stress levels increase the body's demand for magnesium, rapidly depleting stored levels. Certain medications, proton pump inhibitors, PPIs, some antibiotics, and diuretics can interfere with magnesium absorption or retention. Cooking methods. Boiling magnesium-rich vegetables can cause the mineral to leach into the cooking water, which is often discarded. Risk factors for deficiency, hypomagnesemia. Gastrointestinal losses, chronic diarrhea, Crohn's disease, celiac disease, or gastric bypass surgery. Diagnosis. If a magnesium deficiency is suspected, a healthcare provider will typically perform the following physical exam, checking for neuromuscular signs like muscle twitching, abnormal eye movements, nystagmus, or positive Chvostek and Trousseau signs. Blood tests. A serum magnesium test is the primary diagnostic tool, alongside a basic metabolic panel to evaluate calcium, potassium, phosphate, and kidney function, creatinine. Electrocardiogram, ECG performed to rule out or identify any heart arrhythmias caused by the electrolyte imbalance. Urine tests, a 24-hour urinary magnesium excretion test or fractional excretion of magnesium, FEMG, may be used to distinguish whether the root cause is gastrointestinal or renal magnesium wasting. Recommended daily allowance, RDA. The amount of magnesium you need daily depends on your age, sex, and life stage. Adult men from 19 to 30 years 400 mg per day. Adult men 31 plus years 420 mg per day. Adult women from 19 to 30 years, 310 mg per day. Adult women 31 plus years, 320 mg per day. Pregnant women, 350 to 400 mg/day, depending on age. Top magnesium-rich foods. Incorporating a variety of these foods into your daily meals is the best way to meet your magnesium needs. Values are approximate per standard serving. Seeds and nuts. Pumpkin seeds 1 ounce/28 g, 156, 160 mg. Chia seeds 1 ounce/28 g, 111 mg. Almonds, dry roasted 1 ounce/28 g, 80 mg. Cashews, roasted 1 ounce/28 g, 72 to 74 mg. Leafy greens and vegetables. Swiss chard, cooked, 1 cup 150 mg. Spinach, boiled half a cup 78 mg. Avocado 1 medium 58 mg. Legumes and soy. Black beans, cooked, 1 cup 120 mg. rxfood.com. Tofu, firm 1 cup 146 mg. Edamame, shelled, cooked 1 cup 100 mg. Sheaf of rice whole grains. Brown rice, cooked 1 cup 86 mg. Quinoa, cooked 1 cup 118 mg. Oats, rolled, dry half a cup 60 mg. Other excellent sources. Dark chocolate, 70 to 85% cocoa, 1 ounce 64 to 65 mg. Fatty fish, e.g., salmon, cooked, 3 ounces 26-30 mg. Banana, 1 medium 32 mg. Tips to maximize magnesium absorption. To get the most out of the magnesium in your diet, consider these evidence-based strategies. 1. Eat whole, unprocessed foods. Focus on a balanced, nutrient-dense diet rather than relying on fortified processed items. 2. Soak or sprout nuts and seeds. This process reduces phytic acid, an anti-nutrient that can bind to magnesium and inhibit its absorption in the digestive tract. 3. Cook smart. Steam or lightly sauté leafy greens instead of boiling them to retain more of their mineral content. 4. Space out high-dose minerals. Excessive zinc or calcium supplements taken at the same time as magnesium-rich meals can compete for absorption in the gut. 5. Stay hydrated. Proper hydration supports overall mineral absorption and healthy cellular function. 6. Manage stress. Since stress depletes magnesium, incorporating practices like meditation, deep breathing, and adequate sleep can help preserve your levels. Types of magnesium supplements.